When we talk about addiction, we usually think about drugs, alcohol, or tobacco. But addiction can also involve food. Today we're going to explore how food addiction is real and how it follows the same patterns as other addictions you may already understand well. Food addiction shows up in two ways: substance addiction and process addiction. First, the substance side of food addiction relates to sugar, flour, and ultra-processed foods. These substances affect your brain in similar ways to alcohol, narcotics, and tobacco. Second, the process side of food addiction relates to the act of eating itself. Overeating, emotional eating, grazing all day long. This is similar to the process addiction like shopping, gambling, or pornography. It's not just what you're consuming, but how and why you're consuming it. Both types are real. Both can be serious. And food addiction can follow the same diagnostic criteria we use for substance use disorders and gambling as a process disorder. There are 11 criteria used to diagnose. These were created for drugs and alcohol, but they absolutely apply to food addiction as well. If you have 2 out of the 11 criteria, that means you have mild addiction. 4 to 5 means moderate, and 6 or more out of the 11 means severe. Let me give you just a few examples of how these criteria show up with food. Unintended use. You plan to eat 2 slices of pizza, but end up eating 4 or 6 or the whole box. Or you start a diet in the morning and quit by nightfall. Failure to cut back. Your doctor tells you to reduce sugar for your health, but you just can't seem to do it. Cravings. We all know what it feels like to crave certain foods. Time spent. Driving out of your way, maybe even 30 minutes, just to satisfy a craving. Then there's tolerance. A normal serving size no longer gives you that feeling you're chasing, so you need more and more. Half a bag of candy used to be enough, but now you eat the extra large bag in one sitting. And withdrawal. When you stop eating sugar and flour, you might experience flu-like symptoms, headaches, or depression. Sound familiar? The key definition of substance use disorder is this: the individual continues using the substance despite significant problems caused by that substance. Consider this sobering fact from the American Diabetes Association. 160,000 people with diabetes undergo amputations each year, and 80% of non-traumatic lower limb amputations happen due to diabetes complications. Someone who has had an amputation has a worse chance of 5-year survival than someone with heart disease, breast cancer, or colorectal cancer. Yet many people continue consuming the very foods that make their diabetes worse. Food addiction is real. It follows the same patterns as other addictions. And just like other addictions, it can be addressed and treated. Understanding this is the first step toward healing your relationship with food.